Hello everyone, good evening, and welcome to today's expert panel on sudden cardiac arrest and CPR awareness. This topic is so critical to discuss, given that sudden cardiac arrest remains the leading cause of death in student athletes, as well as the leading cause of death on school campuses. My name is Audrey, and Lena and I are going to be moderators for this event. Before we get started, I'd like to briefly introduce ourselves and the organization that is hosting this event. We are here today representing Guardians of the Heart, a student-led nonprofit whose mission is to empower young people with the knowledge, tools, and resources to take control of their heart health from an early age. Today's conversation will center around sudden cardiac arrest in young people with a special focus on CPR training and awareness in schools and communities. We are incredibly fortunate to have such an outstanding group of experts with us who will be sharing their knowledge on this crucial topic. I'm going to pass it on to Leah to introduce our panelists here with us.
First, we have Dana, who co-founded Project Adam New York to prevent sudden cardiac death in children. Inspired by her husband's cardiac arrest during their son's soccer practice and her co-founder's son's similar experience, Dana has since led efforts that have trained over 700 people in CPR and AED skills, placed more than 50 AEDs in schools and youth sports leagues, and passed legislation requiring youth sport leagues and camps to establish AED implementation plans. Second, Chief Barton has been a dedicated member of the emergency medical services field for 34 years, with 28 of those years spent as a paramedic. He currently serves as the chief of Port Chester Rye-Brook EMS, a New York State certified instructor coordinator, and an American Heart Association instructor for nearly 20 years. Next, Dr. Jain is a pediatric cardiologist and director of advanced cardiovascular imaging and pediatric cardiac MRI at Maria Fareri Children's Hospital, as well as an associate professor of pediatrics, radiology, and public health at New York Medical College. Her clinical and research expertise includes advanced cardiovascular imaging, congenital heart disease, myocarditis, and more. She serves on the advisory board of Project Adam and has been honored with the New York Medical College School of Medicine Dean's Faculty Award and the 2023 New York State Woman of Distinction Award. Fourth, Aniston is a senior at Tennessee High School and the 2024 American Heart Association National Teen of Impact winner. As a prominent student athlete, Aniston is supporting the life-saving mission of the American Heart Association by working as a grassroots level to raise funds, educating others in hands-only CPR, and working with other local hospital systems to inspire the next generation to live longer and healthier. Next, Dr. Mueller is a primary care sports medicine physician currently working out of the Department of Orthopedics at Northwell in Westchester and Orange counties of New York. He sees patients from childhood to adulthood for all varieties of sport medicine and non-operative orthopedic concerns. He is currently the head team physician for the United Soccer League, One Westchester Soccer Club, and assistant team physician for Pace University Athletics. Finally, Dr. Anusha is a sports and rehab medicine physician at Westchester Medical Center, Valhalla, New York, and is an assistant professor with the Department of Rehabilitation Medicine at New York Medical College. She is on the editorial board of the American Journal of PM&R. She serves as the secretary of New York Society of PM&R and volunteers with Project Adam.
Thank you again for joining us today. Leon and I will be guiding the discussion using some pre-prepared questions, and we will use the Q&A session and with the Q&A session. So everyone, all attendees, feel free to type in like the Q&A box on the webinar with any questions you may have. So let's start with community awareness. What are the most common misconceptions about sudden cardiac arrest in young people, and how can we dispel them through education and outreach? Dana, would you like to start us off?
Okay, I'm not a doctor, but I would say the biggest misconception is that people think that this doesn't happen in young people that often, and it's probably never going to happen to my child or somebody in my community. So I think people dismiss the need to be aware of this, whether it, knowing your family history, to be see a physician, or just from a community standpoint, really being prepared in case a cardiac arrest happens at an event at school or a sports program. And it's not only just preparing for the children there, it's preparing for the whole community, whether it's parents, coaches, and others who attend those events. So basically, that people think this never happens in children. And unfortunately, with our personal experiences, we've learned how often that it does actually happen.
Thank you so much for sharing. Chief Barton, we would love to hear your thoughts on this.
One of the issues is that there's often a much greater apprehension for bystanders when something happens with a child. A lot of people are fearful of liability and just concerns versus understanding really what their Good Samaritan protections might be. But certainly when a child is sick or injured, a lot people are much more apprehensive than they are getting involved with an adult scenario of the same variety. So I think that's something that that's a big barrier that can be overcome with proper education and just a general understanding of the frequency that these events can occur. I don't want to blow up the doctor's opportunities to explain some of the technologies are out there, but on the education outreach side, getting people to understand that there are certainly genetic predispositions for some of these cardiac conditions that can be detected earlier could certainly, again, just generally inform people better on the potentials that exist.
Thank you. Dr. Jain, what are your thoughts on this?
I guess I have to agree with everything Dana and Kenny said. So I'm just going to build up a couple of things. Main things are, yes, we're talking about sudden cardiac arrest in children, and that is a topic. But again, just in terms of statistic, it is a rare phenomenon compared to in the adults, but it does happen. And sudden cardiac arrest, it can happen in your community. And when we talk about, even CPR training, I think CPR training is not only, people think that it's only for medical professionals. And I think that is the myth which we need to, break. And, it's not about that, we need to be scared about sudden cardiac death. And, there needs to be more of a fear out of it. But I think the reason why we do these webinars or awareness is mainly to, again, empower people. And as, Chief Kenny said, there is apprehension when something happens and people don't know what to do. And I would say by personal experience, it's not only with the kids, even for the adult, because people read about CPR or they've heard about it, but they've never actually done it. And so either it could be an adult or a kid, but to jump into that situation when it's so stressful is where people are scared. And that is where we need to work together to, educate them again and again and again and again to say it's okay and it's easy and you just have to jump and do something instead of just freezing right there. So it's more just empowering people, training them and telling them it's okay, however you do it, even if it's not 100% right or the way you think it should be done, just do it. And I think it's the awareness, so that it's not really a misconception which people have. It's more of that fear and unawareness, which I think we need to all work together to dispel.
Thank you so much for that. Aniston, what do you think about this?
Yeah, I mean, I 100% agree with as far as you were saying about education. There are so many missed opportunities of education in schools whenever we're talking about, the youth and sports and their relatability to heart health. And I think that's a big misconception is that people think that heart health issues only happen to unhealthy people or older people. And in my experience, talking to a bunch of other teens and younger people across the world and hearing their experiences with heart health and how they have had cardiac arrest or heart disease or strokes and how they were able to come back from that from places like the American Heart Association that have that education. It's just mind-blowing and it put into perspective how severe this is, especially in the youth. So I think some great efforts could be, advocacy like you all are doing, social media campaigns. I utilize social media a lot during my time fundraising and advocating for the American Heart Association, and also just like I was saying, furthering education in schools.
Yeah, that's very true. Thank you. And Dr. Mueller, what are your thoughts on this?
Yeah, so tough acts to follow so far with a lot of good information there. But I would definitely agree that similar to what Dana said originally, one of the biggest misconceptions that I see is that people don't think it happens to kids. I was just before we started today, I was looking up a statistic that I found from the Children's Hospital of Philadelphia that said each year sudden cardiac arrest claims the lives of over 2,000 children and adolescents in the U.S. And it accounts for approximately 3 to 5% of all deaths in children aged 5 to 19. So it definitely does happen. And then building off again on what everyone else said, awareness, training, preparation, all very important to help have good outcomes after sudden cardiac arrest. Resuscitation and bringing people back does happen. And so the more practice people have, the more knowledge the whole community has, the more likely you're going to end up with a good outcome. And so, yeah, it just not just knowing CPR, but also practicing it and kind of having it in your brain as, oh, this is exactly what I'm supposed to do. I don't need to think about it. It's just kind of built into what I already know is what's going to help create good outcomes.
Thank you. And lastly, Dr. Nusha, do you have any other perspectives on this? Yeah, sorry for that.
Thank you very much for the invitation. So a few misconceptions include that the child should have any symptoms before this happens. It's often possible that the sudden cardiac arrest is the first thing that happens to them that directs you in that gives you that angle that there could be something wrong with the heart. And some people think that heart attack and cardiac arrest are the same. Some people are apprehensive because of the fact that they might think that CPR would include mouth-to-mouth breathing, and that tends to scare them a little bit as well. And just like the others informed, education in the form of webinars like this are definitely beneficial for the community to dispel those myths. And then it's like the others said, also not very uncommon. It is rare, but it can still happen. So it's better that everyone is prepared. It can happen not just when you're at a game, but it could happen even after a practice session when you're driving your child back home. So I think webinars like this are definitely very beneficial for the community. And I appreciate the initiative to have this in place. And will the recording be available for the attendees or other people that receive this link?
Yeah, we actually have a YouTube channel where we have like all our past webinars and stuff, so we can send that out too after webinar.
Yeah,
Thank
that's
you.
nice.
And okay, so shifting gears a bit, once we address those misconceptions, the next step is action. So are there any like innovative approaches you've seen in schools or communities that successfully reduce the incidence of sudden cardiac arrest in student athletes and like increase the response time and preparedness? And like, could you like speak to some of the challenges in implementing these approaches? And for this, we'll go in the reverse order. So, Dr. Nusha, what are your thoughts? Again.
So just to reiterate, I think it's good to have these webinars to provide an introduction to such an important topic to parents and students from the convenience of their home. But initiatives like Project Adam, they bring it to the school, they bring it to the location of community events. So that's another way to approach this. And as you probably know, or may not, but Project Adam has saved about 200 lives or more in the country. Youth sports health centers, like some initiated in Tennessee by Dr. Alex Diamond, that could be something that could be done. And then there's also some conferences that you could hold, like a youth sports health and safety conference also started by one of the attendings in Tennessee. This can help educate not just healthcare providers, but also athletic administrators, students, teachers, parents, coaches. And then Safe Stars Initiative is a similar initiative that creates an environment where uh, health safety education is provided for emergencies, including cardiac emergencies. And finally, I think advocating for this at a state level plays a huge role as well. There's a few states in the United States where there's laws in place that make having AED mandatory in a school location or in a community health center. The challenges that I've noted and also heard about are the hesitancy to adopt the workflow that is required to put this in place and also implement it in the case of an emergency, not having an AED available or not maintaining it, and then not having enough time for the staff to do their trainings on a regular basis. And then ultimately all of this lead to them or people or bystanders not being prepared to deal with such an emergency.
Thank you. Dr. Mueller, what are your thoughts on this question?
Yeah, so one of the things that I think is most important for schools and communities, especially schools, is having an emergency action plan in place. Yes, the AED and the training is going to be important, but if the school itself or the community event doesn't have an emergency action plan set, sometimes people don't know their roles. And if people don't know their roles of what they're doing when they're supposed to be helping in an emergency, that's when things can go awry, and it may make it so you don't have the best outcome that you're looking for. So by having an EAP, an emergency action plan, and practicing the emergency action plan at the beginning of the season so everyone knows their roles, and having a consistent people in the same roles, if possible, is the best thing that I can see to help schools and communities. As far as challenges, the biggest challenges that I've seen in my training in some schools and community events is cost. I did my fellowship down at the University of Alabama in Birmingham, and we worked with the university, which of course it's a Division I school. They have plenty of finances to be able to help prepare their athletic department, help their athletes, and get them the right things that they need to be able to be safe in sport. But then on the other end, I also worked with some of the local high schools in some of the underserved areas. And it's required to have an AED, but at some of the underserved levels, I would see not the best emergency action plan in place. Unfortunately, not the same participants at each game. So sometimes roles would get confused, and the consistency is just so paramount to making sure things go smoothly in the case of an event.
Yeah, thank you. I'm a lifeguard in the summer, so like the emergency action plan, that's like one of the
Mhm.
biggest things like my boss like emphasizes.
Yeah.
Aniston, what are your thoughts on this?
Yeah, kind of snowballing after off what Dr. Christian said. Financing these things can be expensive. I actually was fortunate enough to go advocate for the access to AEDs and Hearts Acts with Tennessee legislators back in, I want to say, May last year, which actually the Access to AEDs Act got passed recently. But that provides funding in all schools across the U.S. for CPR education, access to AEDs, and making sure that those are renewed, and also making sure emergency response plans are in place. So that kind of falls in line with what Dr. Adusha was saying with having legislative work being done. So that's kind of innovative. Also, I think the transition to hands-only CPR was really cool. I remember I was first CPR certified back in 6th grade, And that's whenever they were still teaching mouth to mouth. And I thought it was like the weirdest thing ever. I like couldn't get over it. And then whenever I got recertified recently, they were teaching hands-only CPR. And then also the AEDs became smarter over time. I thought that was really cool and really neat how they were speaking to you and guiding you through it. And it was super easy, super accessible. So I think those are some really cool things that we've seen recently. Some challenges I think I've found are prioritizing this. Schools, like I've seen some of my local schools that I've talked to about heart health and how I could get involved to further education for the students, don't put it top of their list, which I understand everyone has a ton of stuff going on, but this is something that's so important and needs to be prioritized. So I think prioritization and then also engagement. So whenever you have people coming and presenting to different grades or different schools, sometimes it's hard to get the students engaged and wanting to learn about this because, like we said, people always think heart health is usually for unhealthy or older people. So it's kind of hard to connect the youth sometimes. But I think overcoming those challenges will be pretty easy in the future with things like this and things that you all are doing. So I'm so excited that we have this webinar today.
Yeah, I totally agree. Thank you so much. Dr. Jain, do you have anything to add?
Yes, I'm going to take a completely different perspective because I think everybody touched on really good points. I'm going to take a different perspective into what are, you talked about the innovative approaches. So I can talk about the innovative approaches, maybe secondary to it, but I think I want to get back to the basics. And the basics, the reason why being as a pediatric cardiologist, these are the kids who come for screening. When I take care of these kids when they are admitted to the ICU with sudden cardiac arrest, the most important thing, if we can, from this webinar, we can spread it out to the community. Everybody should know your family history, period. You need to make this a conversation at dinner table, during your Thanksgiving dinners, to understand what is the family history, what that aunt, what that uncle, what exactly was the heart disease. Many times as pediatric cardiologist, we would want to know that, and some of the families do know it because they do talk about it. The others probably don't want to talk about it. So coming back, not even talking about innovation, coming back to the basics, that's the number one risk factor. You need to know your family history really well, need to ask questions, need to find out the medical records. Somebody died. Do you have autopsy reports? What did that say? It really helps for the person taking care. And this, you come to know what are the risk factors, being also aware of your own personal body and any symptoms or signs. And this is again going back to all the athletes and teenagers. If you feel that you have chest pain, palpitations, heart beating fast, difficulty breathing, whatever, no one is going to restrict you from sports, but you need to talk. You need to talk to your parents. You need to talk to your physician. That's how things can get prevented at the forefront. And so I think those are the basic things, making that conversation about sudden cardiac death and heart health awareness, making more of a normal thing when people talk about, hey, how are you doing? And asking each other. And then we build up and say, okay, how can we now prevent it, on a bigger level? And again, not to take up too much time, but in terms of the innovation part of it in the medical field, we do have a lot of, the newer genetic panels have been with advanced technology, can detect different genes which were not detectable before. With advanced cardiovascular imaging, like cardiac MRI, we can look into the heart muscle much more closely, which we did not have that technology before. And then, again, we can talk, that's a completely separate topic, but I'm just saying that there's so much going on with AI, powered stuff, for sudden prevention, for the sudden cardiac death prevention, that a lot of research is going on. But putting it into number one clinical practice and then coming into the community, it's going to take time. But things have been working with the at different places.
Thank you for emphasizing those important points. Chief Barton, do you have anything to add?
This is probably the one question that I have a lot to talk about as far as the innovation side of things. I think collaboration is a big part of it. Dana and Alice Schoen were local community residents who, this sort of started with a simple reach out for a CPR training after a very personal experience with sudden cardiac arrest. And it's evolved into quite the machine at this point. We have a good working relationship, I'll say that for sure. But the collaboration with different facets of the community is really what's making a difference for us. I can't say that we're tangibly sort of reducing pediatric cardiac arrests because it's a low frequency event. They don't happen often. And as Dr. Muller said, the cost is always the big concern. So when we see an opportunity to sort of stick our foot in the door and offer to do something at no cost to facilitate the educational part of this, that's making a big difference in our community. So some of the things that we've done innovatively, we've embarked on a heart safe community designation opportunity that's through the Citizen CPR initiative. We're trying to get we're trying to get up to 15% of our sort of eligible community trained in the skill so that we have a pervasive group that is able to perform this when they're presented with the situation, which is usually without warning. Collaborating with our fire departments, our police departments that we work with has been a big thing, increasing the training and awareness level with all of those emergency responders has been a big step in the right direction. Recently, one of the high schools who we've been trying to sort of stick our foot in the door with for a number of years finally decided to create a health and emergency preparedness focused staff development day instead of the sort of traditional quote unquote superintendent's conference day. It was very focused on health and emergency preparedness. And, we took the opportunity. I think we were able to train almost 140 staff in hands-only CPR just on that one single day. So those opportunities have been great. I'll mention the words medical timeout, but I'll let Dana talk about that since she's the one who actually was successful pushing that over the goal line. But that was another sort of innovative approach that we've taken to try to decrease the response time and increase the preparedness for when these things happen unexpectedly. And the last facet of it is two more pieces, I guess. We're working with our local represented officials, our elected officials, and we have basically with all of the local governments in my coverage area, we've done staff training with all of the elected officials. It takes a little convincing to get them on board with doing it. But again, once we sort of convince the community leaders of the importance of it, it trickles down from there. And I think that's going to be another effective approach for us in time. And the last piece is broadening the access to AEDs. The Youth Sports Initiative that Dana and Alice championed, to get the legislation passed in New York was huge. But my agency has been. We're looking at every opportunity we can to put more of these devices out there and increase awareness and training to go along with it because it makes a difference. We know that the more quickly intervention happens after the sudden cardiac arrest, the more likely we are to see a successful outcome. So I'm trying to train as many people as we can in our communities, at least to the level of hands only, so that they intervene. And just to touch on something Dr. Anusha said, the breathing part of this, most people still think that CPR involves a breathing element. And obviously it certainly can in a healthcare setting, but circulation is key. And getting everybody to understand that simply putting your hands on the chest can make the difference between surviving and not surviving is a big part of the message that needs to get out there.
Thank you so much. All those initiatives you shared are all very cool. Lastly, Dana, do you have anything else to add to this question?
Oh, I can go on and on. So I just want to start by saying that, one huge event that is increase the conversation in this space is Damar Hamlin, who was a professional football player, had a sudden cardiac arrest on Monday Night Football 2 years ago. And, fortunately he survived, but that has created a tremendous awareness. And I always say he's a gift to, sudden cardiac arrest awareness. And that event has really created the awareness, across the country, to every, all the points that I discussed before. Legislation is being passed in many states for cardiac emergency response plans in schools. There's many states that weren't even requiring AEDs at this point, and so everybody's getting a step closer. So that has been tremendous. And as Kenny said, we passed an AED law requirement in youth sports and camps last year. We're currently working on cardiac emergency response plan legislation in schools. And, the key point is that, yes, it's great that New York has AEDs in schools and a certain amount of staff required to have CPR training, but without a cardiac emergency response plan or emergency action plan, people are not prepared. So it's so important to have that plan, have as many staff and students trained in, sudden cardiac arrest awareness and how to respond with CPR and how to use an AED. And because it does save lives. I mean, again, to Anusha's point, we're up to, I think, 52 Project Anim affiliates across the country that are in schools and communities training them. And, the recorded number is 250 lives saved just because a school had these cardiac emergency response plans. And I'm sure it's higher than that. I also like to say, there's fire drills and fire extinguishers all throughout schools, and you don't hear about deaths from fires anymore because they are those plans, and we should model that same thing for cardiac emergencies. And then I want to bring up what Kenny brought up. I don't know if you could see our card here. It's our pre-event medical timeout card that we, ask at minimum all sports leagues, especially, I mean, any sport league, but I know small sports organizations, might not have the time or the resources to put together a big written emergency action plan. But if they at least have, coaches trained in CPR and have an AED accessible on the field, and before every game in practice, just ask 3 simple questions. Where's the AED? Who's going to start CPR? And who's going to call 911? That could be the difference between somebody surviving a cardiac arrest and not, because as we know, every second or minutes count. Ideally you want to have an AED on somebody within 3 minutes of collapse, and we have seen those survival rates go up tremendously. So
Thank you so much for sharing. And thank you so much for everyone. I'm going to pass off to Leah for the next 2 questions.
Okay, so now let's look at how recent advancements are shaping prevention and response. What do you know about the latest advances in technology or medical research that could help prevent sudden cardiac arrest in youth athletes? And how can healthcare providers, schools, and students collaborate to implement those innovations effectively? Let's start from the middle this time. So Dr. Jain, over to you.
I guess I already touched some points on this particular question. Do you mind repeating the question again so that I can have the, my train of thoughts again? Do you mind repeating the question?
Yes. What do you know about the latest advances in technology or medical research that could help prevent sudden cardiac arrest in youth athletes? And how can healthcare providers, schools, and students collaborate to implement these innovations effectively?
So in terms of, let me start with the research part of it. So this is a topic of interest all across the board. American Heart Association, the scientific sessions are actually a great meeting place because all the different minds who are, working on different research or projects, they all come together. It's all about understanding, going back to very basics in terms of the risk factors of sudden cardiac death in children. In adults, it's, the predominant reason is a coronary artery disease, but in the, children and young adults, either it's related to heart muscle issues in terms of different kinds of cardiomyopathy or heart electrical conduction system. And so different groups have been working on it. My personal clinical and research interest is based on heart inflammation, which is myocarditis. And, I lead a big multi-center research study. We are trying to understand more about the risk factors, the management, prognosis, and also using advanced cardiovascular imaging, which is cardiac MRI. As I said, it's a non-invasive biopsy where you can look into the heart muscle, and kids who have already been diagnosed with these underlying heart conditions or with even myocarditis, it gives us much more information. So there are groups who are looking at all the genetic risk factors. So research is definitely happening, understanding the risk, the outcomes, the prognosis into sudden cardiac death and for its prevention. And also, I know there are certain groups who are working very much into, again, the AI-powered I know there are those the watches currently, which is only for arrhythmia detection, but there is a lot of work going on in personalized cardiac arrest detection, and that's going to take some time for that to happen. And in the other innovative thing, which I am currently working, is to try to work on with public health officials, is more of a community alert apps where the community could be made aware if there is an event, and where trained people could respond really quickly, or we would know where the AED is accessible. So there are tons of things which different groups have been working. And again, as Chief Kenny said, it's all collaboration. So I'm working down from the groups from the American Heart and with the public health officials and with my other collaborators across the country, where we do research. So in different aspects of it, with the common cause, the common purpose of preventing sudden cardiac arrest in the young children.
Thank you. Aniston, what are your thoughts?
Yeah, so I can't really give a good insight into medical research and technology because I'm not in that field. But the thing that I always preach over and over to the youth is my little golden trio, CPR education, access to AEDs, and emergency response plans. And one thing you can do as a student, or like I'm a student athlete, I play golf. So it's a little bit different than I know I can't remember exactly, was it Miss Dana that mentioned Damar Hamlin? Yeah, so that was like Monday Night Football. They had people on site that were able to thankfully bring or help him out in that situation. But with golf, it's a little bit different because I could be on, hole 16 in the middle of the woods with 3 girls and no coach in sight. So I had to start making those steps and asking my coach, like, hey, if we go to this course, we go to different courses. I was like, at this course, is there an AED here? Is there a response plan in place for where you're at on the course? Is there AEDs on the golf carts? Do you have someone that can come out if need be? So having those conversations, students making that step, and I think I can't remember, I lost my track or my train of thought a little bit, but I think a great place to start is just making those steps, having those conversations with your coaches and with the people in schools.
Thank you. Now let's move on to Dr. Mueller.
Sure. So I'll talk a little bit about the medical research part. As a primary care sports medicine doctor, I have a family medicine background. So I have a good amount of knowledge in regular family practice, heart health, and being a sports medicine doctor on top of that, I'm helping taking care of athletes of all ages, making sure that they have a adequate pre-participation physical exam at the beginning of the year to make sure we are doing any screening for any type of underlying cardiac or health issue that could predispose them to having an issue with sudden cardiac arrest. So in doing so, one of the best research guidelines that we kind of live by in the realm of sports medicine is the 2012 standardized criteria for EKG interpretation in athletes. EKGs in athletes, there can sometimes be findings that are different from the standardized population, the regular population of people that don't participate in sports. So having the knowledge of these EKG changes as a sports medicine doctor can really help prevent false positives in the realm of cardiac issues. It can also help you find things that maybe a doctor without the training about these EKG changes would maybe brush over, that may need to be evaluated further to see if there is any risk of sudden cardiac arrest. Some of the EKG changes will kind of tell you what other further imaging you may need to do, whether it be an echocardiogram, which is an ultrasound picture of the heart, or an MRI of the heart, which Dr. Jain is very familiar with. But as far as research, the standardized criteria for EKG in athletes can be super helpful as long as an athlete is getting an EKG. So for those sporting teams that where EKG isn't the standard of care in their pre-participation physical, that's where it also is important for the doctor to have knowledge of these EKG changes, of these maybe symptoms of cardiac issues, to pull the trigger on ordering an EKG if it's not the baseline thing that they normally do. So that's my talk.
Thank you. Yeah, we also have a similar thing at our school as what you were saying, and we have to be cleared before every season tryouts. Next, Dr. Anusha, what do you think about this?
So during professional games, to evaluate a person for a concussion, usually there's a spotter that's reviewing the video, and that person could also be helpful to identify if someone collapses and if there is any concern for something more than a concussion like a cardiac arrest. I think that could be a good use of technology, which is already in place. And additionally, like Dr. Muller mentioned, the ECG criteria is something that we, as sports physicians, should be aware of to know which ones are critical, because what it can also help with is to monitor athletes who may not have any symptoms right now and to allow them to play. So our job as sports physicians is not to prevent people from playing, but to ensure that they're safe to play and they can continue to pursue their passion without risking their lives. And it is usually a joint decision with the athlete and family, and us presenting the facts to them. And what happens as a result of that is you may find changes not this year, but a combination of the EKG and an MRI and an echocardiogram, which is an ultrasound of the heart, can be repeated at regular intervals to identify if we are seeing any changes which may not have presented previously. And that may be the time when they should probably not be playing. And so that would be how I would say technology can play a role. And recently, 2 years before Damar Hamlin, there was the episode of Christian Eriksen in European soccer. And both athletes were fitted with an implanted cardiac defibrillator. So I guess medical technology standpoint, that is a device that athletes with cardiac rhythm problems get fitted with. Additionally, there could be heart rhythm conditions that could be treated with medication. And they may need to be fitted with a loop recorder that could detect the abnormal rhythm. And then, like Chief Barton and Dr. Jain mentioned, there are genetic abnormalities that they can be tested for. And recently, FIFA came up with basic requirements to do a proper cardiac screening, and that includes screening kids older than 12 years at least 2-year intervals. And that should include their personal medical history and, like Dr. Jain said, their family history in particular, and then focused physical examination and also doing EKG.
Thank you so much. Dana, do you have anything to add?
Not that much, but I do want to mention that so there is in the last maybe 2 years a new AED that came out, which is like the first change in technology, I guess. And I don't like to endorse any one brand over the other because we always say any AED, the AED is there is the best AED because they'll all work. But there is a new device called Avive that's a little bit more technology advanced as far as it's smaller, it's Wi-Fi. It doesn't have a battery. You charge it. You don't have to replace the batteries every few years. So it might be more expensive up front, but in the long run, it's a little bit cheaper to maintain. And it's a little more automated in helping you maintain the pads and the batteries. But that's just from a technology standpoint, the newest innovation in AEDs, which is kind of exciting to see that move forward. But like I said, any AED is a good AED, but that's the latest as far as technology.
Thank you. And lastly, Chief Barton, what is your perspective?
Sorry. I think the biggest thing is the standardization of the testing regimen that needs to be done for pre-screening to find these things, because a lot of the stories, a lot of the experiences that I've heard about are a reactive approach to diagnosing these underlying cardiac problems. You hear about a child that had a sudden cardiac arrest event, survived, and the next thing you find out is that two of his siblings had the same problem, but it was unknown until the first person had it. So I think standardization of the testing with the technology that's available could make a massive difference in just sort of changing that to becoming more proactive about doing the testing up front rather than reactive to once an event has already occurred and somebody's life has been at risk. The opportunity's there, and the technology is certainly going to support it. I've had encounters with students that are wearing loop recorders in schools. They're being watched by a cardiologist. It shows on their telephone. It shows at the same time on a cardiologist's phone when there's an event trigger on the device. So technology is certainly going to help us, make moves towards decreasing the susceptibility to this problem.
Thank you so much. And for our final question, we have heard a lot about current strategies, but what about the future? In 3 words, how do you see this future of youth heart health evolving over the next 5 years? Let's go back to Dana.
Okay, I had no time to prepare for that one in 3 words. Well, I think just based on everything we're saying here is, hopeful. I mean, there's a lot of new technology, a lot of new awareness, and, hopefully we can get more of that awareness and training out to the general public.
Chief Barton, what about you?
I had 2 3-word sayings. One ties into Dana's earlier comment. The first is thank you, Damar, because he had a spectacular cardiac arrest on national television and survived his event and has become an advocate. So I think that experience and that just with the broad exposure that event brought on for the entire country was a very eye-opening thing for many people. We've seen it happen on the playing field, on the soccer field, as Dr. Anusha mentioned. It happened on the bench at an NHL game about 2 years ago as well. That player wanted to come back out on the ice after he recovered from his cardiac arrest. The other is, I would just say the other 3-word comment is just massively increased awareness. There's great momentum right now. There's a lot of initiative in many places trying to increase awareness about just generally not specifically for youth sudden cardiac arrest, but broadly for all cardiac arrest. And I think the more the word gets out there and sort of the more these initiatives get momentum, the greater the survival rate is going to be in time.
Thank
Can I
you.
edit my, I'm sorry, can
Oh,
I edit my
yes.
response?
Yes.
I just think, when you're saying 3 words, we always use the mantra when we're doing training, call, push, shock. Like if everyone, just like in fire drill, just stop, drop, and roll. But for cardiac arrest, the cardiac arrest, call 911, push, start CPR immediately, and shock, get an AED on that person. So those are like a 3-word mantra that if everyone could remember, then it would help them remember how to respond. Thank you.
Thank you. Dr. Jain, what about you?
Yeah, I think I love all those 3 words, which Dana just said, those are my 3 go-to words. But in terms, again, in terms of how is the future, 3 aspects. One, starting from the person themselves, everybody being aware of their own personal health. And so more of in terms of personalized or individualized prevention or medicine. So currently there's a lot of, we didn't talk about it, but a lot of research is going on about heart rate monitoring for a particular person. And how can we detect that if this person, based on the way the heart rate variability is there, this patient at a higher risk. Also, sudden cardiac death can happen in sleep, not only in sports. So if you have an underlying conditions, you can have a certain cardiac arrest while being asleep. So there are all these different technologies which are currently working, to figure out how could we prevent it at that personal level. The second word I would use is more connected and collaboration, something which we've been talking. It's not only just the person, but then having that awareness and the community awareness that if a person is at home, how can that alert the community and see how the person can be saved, or somebody can respond to that emergency before 911 or EMS comes in. So again, that connection part of it. And the third word is, again, prevention. All of this, we hope that this is going to be a much more preventable disease where we don't really have to talk so much about it in the future, because we've taken the right steps right from the risk factors, preventing it, and then acting on it quickly. And so I'm hoping that's going to be the future of sudden cardiac arrest.
Thank you. Aniston, what about you?
I like the little 3-word mantras everyone's doing, like Chief Barton's. Is it thank you tomorrow? TYD? That's what I need to go to. TYD. I'm gonna say that all the time now. But I did 3 characteristics. I think today's youth heart health is empowered. I've seen a lot of people like you two ladies, people I've talked to feel really empowered in using their voice, and using that as an advocacy effort. And then my second word is inclusive. People are learning now more than ever that heart health is for everyone. And my last word is driven, because this next generation is so motivated. I've seen from my last year campaigning for the American Heart Association, and then seeing this year's nominees, there was such a surge in nominees and the amount of impact that these kids and these teens made. So I think everyone's getting really excited, getting really driven, really hopeful, ramped up, and I am really hopeful that it'll make a really huge impact.
Thank you so much. Next, Dr. Miller, what about you?
Yeah, so I picked a 3-word phrase. I say teach the community, which is kind of what you guys are working on here, trying to bring awareness and show how important it is for the entire community to be part of the ability to save someone's life if something were to happen. That's what Dana's working on with Project Adam. That's what Chief Kenny Barton's working on in the community. That's what Aniston's working on as well. That's what we're working on as physicians too, to spread awareness, make sure everyone knows the roles that can be helpful, and just know that everyone can be part of an emergency action plan.
Thank you. And finally, Dr. Anusha, what about you?
So to piggyback on what Dr. Muller said, I hope that teaching the community can ensure, my phrase is ensure that everyone is alive and kicking. So we want the heart to continue to be kicking and the person to be alive as a result of the awareness that the community has as a result of, like Dr. Muller said, this webinar and Project Adam and other initiatives similar to this. And for people to, another phrase that everyone is familiar with, see something, say something. So as soon as they see signs of something being wrong, they should call 911. If they are unable to respond appropriately, at least to know what to do next, as in to call 911 or go get an AED. Those would be my 3 words.
Thank you so much. Now I'm going to pass it on to Audrey.
We've covered a lot of topics today, and we want to thank each of you for your time and insights. I think we have we have 5 more minutes, so we can maybe get to one Q&A, maybe like 2 people can answer it. We're just going to go in the order of which they're asked. I think the first one is, are there any specific types of heart conditions that should be particularly monitored in youth athletes to prevent sudden cardiac arrest? And like 2 perspectives on that. Anyone could just jump in when.
I can take that. Specific types of heart conditions. So yes, as I said, the main two, the way just to understand is one related to the heart muscle, and then one related to the heart electrical conduction system, just going very basic on it. So many of them are inherited. And some of the, cardiomyopathies could, HCM, one of the bigger ones. Again, I don't want to go too much in detail, but it's cardiomyopathy when your heart muscle is either, thick or it's abnormal. And then with the same thing with the electrical conduction system. So going back, the same thing, either your family history, sometimes things can be spontaneous. The person might be the first one who might have this particular condition. And then understanding that there could be genetic causes to it. And one other thing which I would, tell to the teens and athletes, substance abuse can sometimes cause issues too, and can cause sudden cardiac arrest. So everybody needs to be mindful about that. And yeah.
Thank you. Does anyone else want to share anything, or we can close too?
Well, I just want to, not as far as prevention, but just to mention another cause of sudden cardiac in athletes is commotion cordis, like what happened to Damar Hamlin, where, there's no pre-existing condition. There's no way to prevent something like this. It's just the circumstance of the impact on the heart by a blunt blow to the chest at a certain time, at a certain spot. So that's something, that unfortunately is not preventable. So we always need to be prepared in case of an emergency.
Yes, Dana, thank you for reminding me about that. And again, heart infection, inflammation, there are many others too.
I would just add one thing, and that's just to keep your eyes open for other signs and symptoms that may be far more subtle than the sudden cardiac arrest. There aren't always signs and symptoms that are precursors to these bigger events, but there are times where they do exist, where subtle episodes of shortness of breath, related to exercise, that type of thing could be a warning sign. And again, just being able to have the conversation with your parents, with your doctor, will at least open up the opportunity for testing to be considered or done.
Yeah, those are really great points. So I think we're out of time. So thank you to all of our panelists for your important contributions and helpful information. And thank you to everyone for tuning in. Attendees, for anything we were unable to answer, you'll be receiving a thank you email tomorrow. So feel free to reach out. We hope this conversation has provided all of you with some practical takeaways for advocating for better heart health, education, and preventative care in schools and communities. And as we've heard today, the risks are significant, but with collaboration, commitment, and action, we can save lives. And to learn more about Guardians of the Heart and our upcoming initiatives, please visit our website at yeah, I think Lynette just put it in the chat, but www.guardiansoftheheart.net. Thank you again, and we look forward to continuing this important work together.